All right, welcome back, everyone. It is one of the most common New Year's resolutions to lose weight. But for some people, the traditional methods like diet and exercising just may not get the desired results. Surgery may be an option. Dr. Brad Beckham is the director of the bariatric surgery program at Baptist Memorial Hospital Golden Triangle, and he joins us at the table this morning to talk about it. Dr. Beckham, Happy New Year. Good to see you.
Good to see you. Thank you for having me.
So let's talk about bariatric surgery. For a lot of people, this is a last option. Some people sort of think it's taking the easy way out, but for a lot of people, it's kind of a last resort, isn't it?
It came, and that's originally it was thought as a last resort. Nowadays, we're learning, and a lot more research has been done. Less than 1% of people that we qualify medically as obese are able to get out of the obese category and lose enough weight to get healthy through diet and exercise alone. Through weight loss surgery that we do, and there are multiple versions of it, but more than 50% of those same people are now able to get out of the obese category and lose enough weight to get healthier. So we're really considering it almost first line. If you need to lose a significant amount of weight, this is the way to go.
This is probably the way to go. Okay, well, that makes sense. So what you all have is a weight loss surgery program, and it is a program because it's not just come to your office, I want surgery, you have it, and you're gone. There's a lot that happens before the actual surgery.
Absolutely. There's so much more. The surgery, I tell people, is really a small part of what we do. We do psychological counseling, you have nutritional counseling that you go through, and learning this is a whole lifestyle. The surgery is a powerful tool, but it's only one part of that program. And once you're in the program, again, it's a lifelong program that we stay with you and work with you on getting through this.
Can you explain to us in layman's terms, not the doctor terms, what exactly the surgery does?
Sure. There are multiple surgeries out there, but what we do here in Columbus is called the sleeve gastrectomy. In simple terms, we remove about 3/4 of your stomach and leave you with a banana-shaped stomach. And I am talking about the organ of the stomach, not the belly in general. And so that very much limits how much food you're able to take in at any one time. And so that's part of that.
And therein lies the need for the counseling beforehand, because it's not that you don't want to eat the same amount of foods. You can't eat the same amount of foods, right?
Actually, it's both. So yes, you physically cannot eat the same amount of foods, but also by removing part of that stomach, we're actually removing the part of the stomach that makes your hunger hormones. So most of these patients are not hungry, and which is also helps you develop those good healthy eating habits going forward.
When you talk about helping people to get out of that obesity phase, why is it such a problem to be classified as obese from a health standpoint?
Sure, absolutely. So many of our problems, and I've seen a number recently, how accurate it is, it's probably pretty close to 85% of our chronic medical problems that we see can be related to obesity. High blood pressure, diabetes, knee arthritis, hip arthritis, sleep apnea. So many of these things that affect the quality of our life are related back to obesity.
If we could just get rid of the excess weight. And because it's not just a vanity thing, and I think that's what so many people think about when they think about people having weight loss surgery.
Absolutely, and I focus on my patients. To me, the weight loss is the bonus. It's what we call the non-scale victories, the getting rid of your insulin if you're a diabetic, coming off your blood pressure medicines, getting rid of your CPAP machine if you have to breathe at night. Those are the ones that the patients are most excited about, or the ones that tell me, Doc, I couldn't tie my shoes 6 months ago. Now I can reach down and tie my shoes, or chase my kids around the backyard and not be out of breath.
Life-changing.
Those are the ones that are life-changing. They're so much better than the number of the weight loss pounds you lose.
I wouldn't be doing our viewers justice if I didn't ask you, are there any risks involved with this kind of surgery? Sure,
there are always risks involved with this surgery. Fortunately now, with our modern technology, we do this with a minimally invasive way. I use the surgical Da Vinci robot. The surgery only takes about 45 minutes, and it has about the same risk of having your gallbladder removed.
All right. Well, if people want more information about it, also, do you have to have a referral from a doctor? That's the other thing.
No, you do not have to have a referral. You can call our office, and I'm sure put the numbers up there to get hold of us, and we will walk everybody through what it takes and whether you qualify or not.
All right. Well, it could be an option. We appreciate you coming to shed some light on it, and good to see you as always. Come back and see us.
Absolutely. Thank you for your time.
All right.